Hello everyone. The following presentation will be a continuation of the previous presentation on mouth ulcers. So, regarding mouth ulcers, we have already discussed about what are the mouth ulcers, what are the various types of mouth ulcers, what are the non-viral reasons and what are the viral reasons, what is recurrent ulcers, and what are the various complications and symptoms and appearance of ulcers. In the following presentation, I will just focus and highlight on very few and rare reasons for causing mouth ulcers, and that is cancer. So, cancer can also appear as its first sign in the form of a mouth ulcer. So, these ulcers caused by a cancer or mouth cancer are usually single and last a long time with obvious nearby cause present adjacent to it. Mostly, the adjacent cause can be a sharp tooth associated with it, or an irritating denture, or a very high or a sharp filling, or most commonly, it is the habit, the cigarette smoking, or keeping the tobacco quid in your buccal sulcus, which is below your cheek, and most commonly below your tongue, which is called as the floor of the mouth. These ulcers can last longer than 3 weeks and then they should be looked at by your dentist. And ulcers caused by cancer usually appear under the tongue, which is floor of your mouth, or in your below your lip or cheek, under your I should say floor of the mouth, or like a pouch which forms behind your lip or side of your cheek. And the cancer of the mouth is usually linked to heavy smoking and tobacco chewing. This is one of an example where you can see that an ulcer is seen at the border of your tongue, which is a long standing ulcer, maybe 3 weeks plus, and this is how it appears clinically. An ulcer which is not having an obvious appearance of an ulcer, which is reddish with yellowish halo, it appears something like this. This is associated with a sharp tooth. You can see an ulcer on your cheek. So, what types of treatment are there for mouth ulcers? Now, the type of treatment depends upon the cause of an ulcer. Sometimes it is a sharp tooth, so you smoothen it down, a denture which has to be adjusted, and then you may prescribe a regular mouthwash or a tablet. And sometimes, very rarely, an ulcer can be caused by a iatrogenic cause. Iatrogenic means doctor induced, maybe at the site of giving you injection for anesthesia. When you do not listen to our instructions and hold your cheek or mouth tense, then ulcer forms at a particular area, or maybe at an area of surgical field. It's a stress ulcer because of over anxiety, hormonal changes, or because of a lot of anxiety you have for getting an surgical procedure done. You get an ulcer adjacent to the area of surgery or area of dental treatment which is done. That's very rare. But what should I do if I think I have a long standing ulcer? You may think in that way, and then if an ulcer which is lasting more than 3 weeks, then you should visit to your dental team, doctors, take an advice. They will provide you necessary treatment or refer you for an advanced treatment or advanced diagnosis, in fact, to a specialist where biopsy and further investigations are done to rule out cancer and then go ahead with the further line of management. So, how can you prevent mouth ulcers? Is something which most of them frequently ask the dentist. Nothing but keep your mouth healthy, clean, brush, use a good quality toothbrush, a good quality toothpaste. Good quality toothbrush means use a branded toothbrush or toothpaste. I am not specific to any brand, as it is not a company sponsored presentation. So, a good quality toothbrush or a paste, a soft or a medium bristle. Don't use a very hard bristle toothbrushes. Eating good diet rich of vitamins, including good fruits and vegetables, more of fibrous, so that you have more of salivation, so that your mouth keeps being hydrated, and regularly visiting your dentist is one of the things most important considerations to prevent mouth ulcer. When should you visit a dentist for an ulcer? You should visit a dentist if your ulcer is long standing more than 3 weeks. You feel systemically unwell. That means you have an ulcer and then you feel that you have fatigue, you have fever, you have malaise, you have body aches, something other than ulcer, you have other symptoms. Then you should refer to your dentist. And if ulcers keep coming back, they are recurrent, as I discussed in the previous presentation. Recurrent ulcers, multiple times, every week, every month, you see same ulcer is coming again and again, again and again. Then you have to be considerate about it. Treatment options. First thing, as the old-fashioned remedies are there for ulcer. People, some people prefer keeping an ice cube over your ulcer. Some people, over-the-counter solutions are available. They go and buy Smile gel. They go and buy so many brands are available. I don't want to name anything specific, but then you have got so many varieties of gels and ointments XYZ available in the market over the contour. And some people would directly take preferably start taking multivitamins of their own choice, thinking like that. So that's all there, but then ideally we start the management with the topical means to apply. Topical means something which you apply on a surface of an ulcer. We prescribe you a topical anesthetic agent or an analgesic which causes numbness of an ulcer, so that you can use it, and preferably we advise you to apply it before meals so that it becomes a little numb and you can have your food, because definitely with ulcer the most commonest difficulty people feel is while doing eating. And then topical Amilox gel. This is also an anti-allergic drug which has commonly come up, have recently been introduced, or have recently come up with good properties for healing recurrent abscess ulcers. Then we have got various mouthwashes. We have got Rexidine and other antimicrobial containing mouthwashes. You have multivitamin tablets which we advise you. And then at when it is a cold sores or herpetic induced, then we advise you topical antivirals. You have antiviral gels or ointments to be applied. You have topical steroid gels. We advise you steroids also sometimes. And then oral steroids or oral antivirals when it's quite long standing and when it's confirmed that because of some reasons where you need to prescribe all these things, then we prescribe you all those things. And then recently the new therapeutic lasers have been introduced, or a therapy called as low level laser therapy or a cold therapy which has come up for treating symptomatic or a palliative treatment for ulcers. It doesn't heal an ulcer, but then promotes a rapid healing. So these are the various options which are available, and it's doctor's call or a dentist's call to decide what has to be given, what is the flow of treatment, what has to happen. So advisably, if it is, and sometimes ulcers heal by themselves. That's true, but then we need to consider all those things. Thank you.